5 things a white tongue could tell you about your health. Remember how your parents taught you that sticking your tongue out at people was impolite? The only exception was opening your mouth for a medical examination. According to your healthcare provider, what does a white tongue say about your overall health? Your tongue is one of your body's most amazing muscles. It is the only muscle group that is not covered by skin, allowing you to see and touch it. It's also the only muscle group in your body that can move independently of bones and joints. Because we are all unique, not everyone's tongue is the same. Some people's tongues are slightly longer and thicker than others. You may recall from high school that some people can roll their tongues up like a taco, whereas others cannot. A thick layer of connective tissue covers your tongue muscles. The surface of this fantastic muscle is coated with a special mucous membrane. Its root is connected to the floor of your mouth near the back of your throat. The 3 sections of your tongue. While it appears to be a single organ, your tongue comprises 3 sections that each perform a different function. Your tongue sides and tip can complex movement for speech and primary food digestion. Many groups of taste buds are located on the bumpy surface of the back of your tongue. You can't see where the root of your tongue connects to the floor near the bottom of your throat. This is because it keeps the organ stable and prevents it from moving. These sections work in tandem to provide you with a sense of taste and food texture. Taste is one of your body's 5 senses, and it is primarily governed by your tongue. Is that a thin mucous membrane covering the surface of your tongue? It has tiny bumps called papillae embedded in it. Each papilla serves one of 2 purposes. Many people mistake the raised papilla on the surface of their tongue for taste buds. However, most of your papilla is made up of taste buds, also known as gustatory cells. Each contains microvilli, which are microscopic hairs that transmit taste signals to your brain. Because the human body craves variety, your tongue can recognize 5 different taste sensations: sweet, sour, salty, bitter, and savory umami. These tastes can be detected by all areas of your tongue. It also dispels the myth that your language is divided into sections that identify a different taste sensation. When you bite into something, your tongue immediately begins sending messages to your brain about flavor, texture, and temperature. But, in the meantime, it plays an essential role in primary digestion. This flexible group of muscles flips and churns the food as it is pulverized by your molars. Swish your tongue from side to side to combine chewed food with digestive enzymes in your saliva. The mixed food is then directed to the back of your throat to be swallowed by your esophagus. Speech would be impossible without your tongue. It works with the mouth, teeth, and throat to create the sounds that make up all languages. It offers many nuances of the world's dialects, ranging from the lovely rolled R sounds to more complex, guttural syllables. One of the most common myths is that swallowing the tongue is dangerous, especially during seizures. Fortunately, a tough membrane called the lingual frenulum secures this marvel of muscle to the bottom of your mouth. Look in the mirror, lift your tongue, and notice how firmly it is attached from the bottom. As a result, swallowing your tongue is impossible. Consider your tongue to be a roadmap to your health. You can also thank your tongue for protecting you from invading bacteria and viruses. Tonsils and adenoids are small glands located at the base of your throat, towards the back of your throat. These are frequently infected with tonsillitis after catching the germs. Fortunately, these glands trap the infection before it can spread throughout your body. Many people have had their tonsils and adenoids removed due to chronic diseases. On the other hand, other people usually function with these protective glands intact. Have you ever wondered why your doctor always tells you to stick out your tongue and say ah? It's because they understand that the surface of your tongue contains vital information about your current health. So they're looking for any discoloration, like a white tongue. When you're feeling under the weather, you usually notice an unpleasant coating in your mouth and can see it in the mirror on your tongue. It's just one of the many ways your body sends out distress signals. One of the first areas to show signs of a problem is your tongue. When you notice a white layer on your tongue, it does not mean that your tongue is discoloring. Inflammation and swelling of those bumpy papillae can be caused by an infection in your system. As a result, the swollen papilla traps bacteria and debris, giving the tongue's surface a fuzzy white appearance. What does having a white tongue mean for your health? Your healthcare provider can tell a lot about your health by looking at your tongue. A white layer on this muscle can be caused by various factors. Here are 5 common health indicators revealed by a white tongue. Number 1. Thrush. This mouth and throat condition is most common in babies and young children, but adults can also get it. When Candida yeast multiplies too quickly in your body, it can manifest as a white fungal infection in your mouth and tongue. Simple remedies can often get rid of it quickly. Number 2. Leukoplakia. This disorder may occur if you have chronic irritation in your throat and mouth. To protect itself, your tongue may develop an overgrowth of cells that combine with keratin to form a white layer. Leukoplakia is commonly seen in people who smoke and drink alcohol, but it can also develop for no apparent reason. It is usually harmless, but it can develop into cancer cells. Number 3. Geographic tongue. Like the rest of your body, your tongue eliminates dead cells while generating new ones. You may notice white patches on your tongue if some areas of your tongue generate new cells faster than others. These patches of skin can become tender, sore, and infected. Number 4. Oral lichen planus. If your immune system is weakened, you may develop oral lichen planus, a chronic mouth inflammation. It not only appears as a white coating on your tongue, but it can also cause painful mouth and tongue lesions. Although oral lichen planus cannot be cured, it can be effectively managed. Number 5. Syphilis. This bacterial infection is a severe sexually transmitted disease that, if left untreated, can be fatal. White tongue is usually one of its telltale symptoms. Of course, your doctor will run tests and compile your medical history. Risk factors. Several risk factors can increase your chances of developing white patches on your tongue. Many of them are merely annoying and do not threaten one's life. Your tongue may be affected if you fall into any of the following categories. Young children and the elderly are more likely to develop white patches on their tongues and mouths due to thrush. Antibiotics used to treat bacterial infections can sometimes cause problems. You may be allergic to certain antibiotics or overuse them. Natural yeast in your mouth can increase, resulting in an infection and white patches on your tongue. White patches may appear if your tongue is damaged due to chewing or other trauma. Dentures are well known for irritating the gums, mouth, and tongue. Hypothyroidism is when your thyroid is underactive, it does not produce enough hormones to keep your metabolism in check. It frequently affects the color of your tongue. Substance abuse of tobacco, smoking, alcoholism and drug abuse all harm your entire body. They frequently leave chemical residues in your mouth, which appear as pale patches on your tongue. Do you drink enough water daily? If you don't, you risk becoming dehydrated and jeopardizing your health. A dry mouth, bad breath, and a white tongue are possible symptoms. Many medications and cancer treatments can cause a dry mouth and a white coating on your tongue. Brushing and flossing your teeth after each meal, or at least twice a day. Also, don't forget to brush your tongue or use a tongue scraper. If you don't, bacteria and food particles can cause tooth decay, gum disease, and tongue discoloration. Last words on what a white tongue means for your health. Your tongue may be small, but it plays a vital role in maintaining life and your well-being. Take care of it every day with gentle brushings or scrapings, and become acquainted with its surroundings. If you notice a white coating, an unpleasant taste, or odor, it could be a sign of a health problem, even something as minor as halitosis. Thank you for watching. Please give it a thumbs up and like and share it with any family or friends who find it helpful. Please hit the subscribe button.